Can you see me clearly? Hear me?
Yes, ma'am.
Yeah, okay. All right, great. So let's begin today's session. Sit comfortably. Keep the back and neck straight. And when you feel ready, very gently close your eyes. Start observing the breath. Follow the natural flow of the breathing. Slowly shift the attention to the posture. Keep your body aligned and make the required adjustment so that your body is both stable and comfortable. Coming back to your breath, begin to deepen the breathing. Use the breathing to relax your mind. We'll open today's session by chanting Om 3 times, followed by 3 Shanties. Take a deep inhalation for Om. Shanti, Shanti, Shanti. Join your palms together and begin to rub the palms together. Keep your palms on your eyes. Very slowly, while blinking and looking at your palms, begin to open up your eyes and come back with a big smile. Let us begin today's session. Okay, so now we are today going to learn a new pranayam technique, and this pranayam is called Bhastrika, Bhastrika, Bhastrika Pranayam. In English, it is called bellows breath. Bellows breath. So the term Bhastrika literally means the bellow, right? So bellow is an instrument that is used by a blacksmith, right, in order to increase the or keep the flow of the fire, right, and the way in which they blow the air in that bellow, that is exactly how Bhastrika Pranayam is done, right? So from this exact analogy, you can also understand this thing that when the blacksmith blows the air through the bellow, um, the fire it increases, right? So the heat in the body it increases after you do Bhastrika, right? So this is again a heating pranayam, and this is quite an intense pranayam. So Bhastrika has like a lot of restrictions also to it. Not everybody can do Bhastrika pranayam, and because the flow of the breath during this practice is quite rapid, so immediately, like a lot of people, they feel discomfort or dizziness very, very easily. So all other pranayams, you will see that the breath, it's in a more controlled fashion, but over here the practice requires you to go at a faster pace, right? So it's not advisable for everybody. Okay, I'll tell you who all cannot do it later on, right? So Bhastrika Pranayam, again, it requires a lot of effort also. And there are multiple ways of doing Bhastrika. Okay, so suppose you come across some technique somewhere and then I teach you some other technique. So don't get confused again because this technique has more variations than others. Okay, so the way in which the breath is taken. So I will teach you again the traditional technique which is given in Hatha Pradipika. So we are only going to follow the original or the traditional practices. And apart from that, all other practices are variations. And those variations are can be correct in themselves, but they are again variations of the original practice only, right? So again for Bhastrika, you need to make sure that you are in a comfortable sitting posture because when you take the breath at such an intensity, the body tends to move. Okay, like in Kapalbhati, even though you are trying to keep the pace slower in the beginning, still there is movement in the body. So same way Bhastrika is involving active inhalation and active exhalation. So it is like different from Kapalbhati because both the processes of breathing they become active. Okay. This is a key feature of this practice. Both of the processes they become active, and at the end of Bhastrika we go for one round of Surya Bhedan. Okay, so after this set of active inhalations and exhalations we go for one round of Surya Bhedan pranayama which we learned yesterday. So this practice is basically done from the chest. Again, in variations, you will find the use of the abdomen, right? Or maybe one breath is through the abdomen and one process of the breath is through the chest. But we are going to do the practice where both inhalation and exhalation are active and we are doing thoracic breathing. Okay, so again, the next difference from Kapalbhati is that in Kapalbhati we are making use of the abdomen, and there is active exhalation with the help of the abdomen. In Bhastrika, active inhalation and exhalation, but there is thoracic breathing. Okay, so second way in which it is different from Kapalbhati. So I'll demonstrate the practice, but I'll just tell you briefly about some precautions that you have to take during the practice. Right. So one thing is the body tends to move when you do Bhastrika, so you have to avoid that. There should be no movement in the body. Only chest is moving in and out during Bhastrika. Second thing, because there is so much effort that is put in during this practice, so there is a very fine line between doing the practice properly and straining yourself, right? So if you face any kind of dizziness or you feel as if the sensation of vomiting sometimes occurs for certain people, or headaches begin, right, means that you are not doing the practice correctly. Or if too much sweating is happening in the body, means Bhastrika is not being done properly, then you have to change the practice or slow down your pace. So, what was I going to say? Wait, I just lost my train of thought. I'll come back to that point later when I remember it. Right. So, yes, Bhastrika expels out a lot of toxins from the body. Right. So, of course, there is some amount of sweat that you might experience, and it is a heating pranayam, so that is going to happen, right? But if you undergo excessive sweating, that is a problem. Then you have to go for a different pace. And like Kapalbhati, you can start Bhastrika at a slower pace. So generally, the demonstration that is shown or given is at a very, very fast pace. But for a beginner, it is good to start with the slow pace, then come to the medium pace, and then move to those are advanced level practices, right? Where the inhalation and exhalation, that exchange is taking place at a very, very fast rate, right? So in Bhastrika, the breaths per minute are more. Generally, we take 14 to 15 breaths in a minute. When you do Bhastrika, this number increases. So per minute, the number of breaths are much more than the normal pace at which we breathe. Right. So I'll just demonstrate the practice to you one time, and then we will see, I'll tell you all other things about the practice, right? So I'll just keep one hand on my chest so that you can see the movement, right? And keep the other hand. The back and neck should be straight. You prepare the breath before you enter the practice of Bhastrika. When you begin the practice, both inhalation and exhalation, they will become active, right? So we do a few rounds and then we go for one round of Surya Bhedhan. Then you form the mudra with the right hand. Close the left nostril, inhale through the right. Close the right nostril, exhale through the left. This completes one round of Bhastrika. Okay, so a few repetitions of the pranayam and then close it with one round of Surya Bhedhan. Right, your face should be relaxed, your body should be relaxed, but there should be no movement. And inhalation and exhalation should be given equal time in the beginning, right? So generally when we go for this kind of active inhalation and exhalation, what we do is exhalation is too fast. Inhalation, we take our time, right? But exhalation, it's very, very fast. So you have to try to gain control over the exhalation and make sure it is as fast, it's taking the equal amount of time like the inhalation is, right? Any doubts so far?
Yes, ma'am. Ma'am, I have seen that in Bhastrika Pranayam, when they take their hands up when they're inhaling and getting their hands down while exhaling. So, because I have practiced Bhastrika Pranayam during some course which I was doing with Art of Living. So, they told us that, with force you have to breathe in and force you when you get your hand down. So, when your hands are going up, you open, and when it's coming down, you close. So, inhale, exhale with force, and you have to sit in Vajrasana. So I just wanted to cross check that, is it mandatory for the hand movements or just one of the variation?
It is a variation. So Sri Ravi Shankar, he came out with a variation that and this variation has in fact gotten a lot of fame, right? A lot of people practice in this way.
Yeah.
Yes, this question comes up a lot actually. But is the way in which I have demonstrated, is it correct? Can we sit cross-legged, right? Because generally you sit in Vajrasana when you go for this technique, right? So again, it's a variation. Bhastrika can be done while sitting in any normal posture where your back and neck are balanced.
Okay.
Later on, a lot of people, they came up with the variations, but only follow variations which are authentic. So like Art of Living, it is quite authentic. So you can do this variation also. Yeah. But if somebody is introducing their personal variation, then it can become problematic. So you have to be careful of that. Right? So Bhastrika, what are the contraindications for this practice? So there are multiple contraindications when it comes to this practice. First thing is, of course, you can see that the chest is moving in and out, right? So it is uh, placing some pressure on the heart. So any kind of heart patient, high BP patient, right, they cannot do this practice. In case of stroke, again, avoid the practice. Any chest related issue. So some people who've had, tuberculosis or any chest related issue, it places a lot of pressure on the lungs, right? So if they are in their recovery phase, you have to uh, either avoid the practice completely, or you will have to check the progress. So your presence will be very important, and their pace should also be reduced. So right now, like I did not demonstrate at a very fast pace. So generally, it's done even faster than this. Uh, I demonstrated at a very medium level pace. So you can make them practice slowly, right? So slow pace will be, so you are taking enough time for the inhalation and exhalation. So even for you right now, you can start at this, and it will be actually good because it will again build up your foundation, right? It will make sure that inhalation, exhalation remain equal. All of these little things which are very important for the practice, they will get covered when you go for a slower pace, right? Um, anyone who has vertigo, right? Again, avoid the practice of Bhastrika. In case of anxiety, again, Bhastrika should be avoided. In the case of hernia or ulcers, again, because diaphragm is constantly moving up and down, so it's again impacting the abdominal region also. So all the basically patients who have any chest related issues, if there is any surgery, then after the surgery, avoid this practice, right? So because the first 6 months, 3 to 6 months are very crucial after any surgery, right? So for first 3 to 6 months, you have to be very careful, and this is again an intense practice. So other practices which are easier to do, those can be introduced, but not Bhastrika, right? Again, in case of any pith related disorders also, so all the things which are caused due to high pith in the body, all of those people, they should avoid this practice because it is increasing the heat of the body and it works on the digestive fire also. So it increases the digestive fire, which is one of the very major benefits of Bhastrika, right? So in that case, again, you have to avoid the practice. So it will include a variety of other things also, right? A variety of other symptoms also that show up on the body due to pith personality, they should avoid. In general, if somebody has pith personality, this will only increase that. So they will have to maintain a good balance, either maintain a good balance with other pranayams or they have to completely avoid this pranayam, right? So Bhastrika, even though it can only be practiced by a few people, it has a lot of benefits. Okay? First thing is the oxygen in the body increases because of Bhastrika Pranayam, and this happens because the number of respirations per minute that increases, right? So in 1 minute, if you take 14 breaths, then a particular amount of oxygen is acquired and the exchange is taking place. Now, when the number of breaths in that same minute it increases, then of course the intake of the oxygen in the body that also increases because rounds are increasing, right? So oxygenation of the blood takes place properly when one practices Bhastrika, right? Then Bhastrika is a great pranayam to burn all the toxins in the body. So it is a great practice for detoxification of the body. So you will see a lot of people who practice Bhastrika, sweating does happen, all right, but excessive sweating is a problem, right? So there is the toxins are released from the body, be it in the form of sweat or in the form of carbon dioxide being released, because again the number of times like the oxygen is increasing because the cycles have increased. Same thing, the carbon dioxide is also expelled out like in a larger quantity per minute because the number of rounds they increase, right? So because of this quality of Bhastrika, it is a great pranayam for balancing Vat Pitta Kapha, right? All the three doshas get balanced when one does the practice of Bhastrika Pranayam, right? Because there is detoxification, and the toxification is what leads to the imbalance in all the three doshas, right? All three doshas, right? There is imbalance that is caused due to the toxins getting built up, right? So then again, all other benefits that take place because of proper oxygenation, they will all begin to occur when you do Bhastrika Pranayam, right? So all the cells will get proper oxygen, especially if you insert the practice of retention in it, then all the exchange that is taking place, oxygen reaches each and every cell, there is proper oxygenation of the body, and you become more active after you do Bhastrika, right? So Bhastrika, if you do this practice, then again your all the work that you are doing, it's like pushing you towards that kind of energy that, okay, get everything done, right? On a mental level also, when you do Bhastrika Pranayam, you will see this thing that the mind, even though this practice pushes you to, towards the energy where you get the work done, it also calms down the mind, right? So when you do such an intense practice, so suppose I'll explain the example of some physical exercise, right? So you will see that some exercises, they're done at a very, very fast pace, right? And as soon as you stop doing those exercises, suddenly, you feel all the impact at the end of the practice, right? As soon as you suspend the practice, you begin to see, okay, maybe all the hormones that were supposed to get triggered, so you feel that impact immediately of all the biological change that has taken place, right? Even in active meditation, if you see, where Osho has also introduced dynamic meditation. So after that, he gives a time for pausing, right? that is when you see the impact of such rigorous movement in the body. So immediately after you do Bhastrika, you feel as if, when this you'll experience as you do it. So there is a state of calmness, quietude basically is triggered when you do Bhastrika. It's a great pranayam for you to clear your mind, to gain that sense of clarity. It improves decision making, all the things that, an unstable mind it causes, um, all the barriers it creates, those are sorted out because of Bhastrika Pranayam. Even on an emotional level, because it is such a rigorous activity. So when you're emotional, if you would ever see, when we are very emotional, we go into a lot of activity, right? If we are angry, we will shout like anything, or our hands will move like anything, right? So when the emotion grips us, right? So body, again, there is so much movement in the body. So when a person is very very emotional, and they're not able to understand how to handle them, so with the rigorous practice of Bhastrika, the emotions also, they get a direction, they get a way of getting released basically, because there is such rigorous movement. And you will see when people move the body very rigorously, a lot of um, emotional cleansing also takes place because of that thing, because uh, you trigger that thing, or you allow this triggering allows that thing to uh, settle down basically, right? And on a spiritual level, again, Bhastrika is connected with whatever increases your digestion is very very important. So this saman vayu, it increase, it's there is an increase in this vayu of the body, and this is considered to be a very significant vayu when the spirituality, when seen from a spiritual perspective, right? Because two opposing forces, apan and pran and apan, they are the meeting point is saman, right? So again, Bhastrika, because on a physical level it is improving digestion, but on a spiritual level also, it has multiple benefits. It prepares the mind for meditation. So if you do Bhastrika and then you sit and observe your breath, right? You will see that you are able to connect with your object very easily, because it's getting you to that state where the mind can stop, chit chatting for a while, right? There is a sense of silence that is experienced. So apart from this, you can read multiple studies and multiple benefits. There are so many, there are endless benefits when it comes to all the pranayams, right? Any doubts in the technique, how you have to do it?
Ma'am, just want to know that is there any pranayama, which we can do, which any kind of a person can do, even if they have, even if they are heart patient, or suppose they have diabetes, any BP issue. So, is there any breathing exercise which, in general, everybody can do? Like lot of
Okay.
people in one of the sessions, I don't remember which session it was, maybe the asana one or maybe yours only, where people lot of times they hide, or maybe lot of time people they are not aware only that they have this issue. Like I know a couple of people, they realize it very later that they have depression issue or anxiety issues. Sometimes people are not aware. So I don't want anybody to get introduced to such kind of a breathing technique. So if there is any breathing technique, any pranayam which is just good for everyone for that matter. So I just wanted to know that.
Mhm. Okay, so in the upcoming classes, we will cover a few pranayams which have very, very less contraindications. So,
Okay.
like Ujjayi has very less contraindications,
Okay.
and same Sheethli and Sheetkari, Brahmari pranayam has very, very less. So, let's just like as we cover the course, you will get to know like which pranayam is safe to practice. But apart from this, to answer your question, pre-practices are the best for like they are the safest. So we are not looking for the best, but the safest option, right? If somebody doesn't know they're going through depression, later on they realize. So what is safe for them is are the pre-practices, right? So abdominal breathing is safe for everyone. Anulom Vilom, very very like very little contraindications. Like if you have cough cold fever, of course the person won't be able to breathe, no? So That is why the contraindications are placed on these things. But apart from that, and I told you, Anulom Vilom has immense benefits, and you can go reach the final goal also as you deepen your practice. So you can, these are two of the safest practices that you can give to anyone. Even if somebody is in a laying posture, they can do the practice of abdominal breathing, right? So they don't even have to sit for that. So it doesn't like, it's not always about discovering the things late. It's also about sometimes the body doesn't allow. So, what will you introduce to someone who is sick, right? So, these practices are more effective, and pranayam is mostly for like after you perfect asana, right? So, already it is assuming this that the state of the body is correct. Now it is used as therapy, but most of the practices you will see, they are very, very specific. They require you to sit straight and stably, right? So, even we are not able to sit in we are not able to sit stably. So what about somebody who is ill, right? For them, this is very, very far off. So, spirituality is, when seen from a spiritual perspective, yoga is not for everyone. There is a restriction. But therapeutically, yes, it is for everyone. Yeah. So any other doubts that I can clear?
No, ma'am. Thank you so much.
Oh, great, great. So let's practice only. We don't have a lot of time to practice also today. So we'll just go for a few pre-practices first, and then we will do Bhastrika. At any point of time, if you feel dizzy, uncomfortable, suspend the practice completely and go for deep breathing. Okay. So sit straight, sit comfortably, and very gently close your eyes. Start connecting with the natural flow of your breath. Check your alignment, adjust your body. Gently come back to the breath and go into the practice of Puraka and Richaka. We will begin with the practice of abdominal breathing. Keeping the back and neck straight, bring the mind to the abdominal region. Exhale fully. As you begin to inhale, feel the abdomen rise. As you exhale, contract your abdomen properly. Continue this pattern of breathing. 3 more breaths, and then we will suspend our practice. Simply observe the natural flow of the breath. Observe the changes and differences after the practice. If you feel the need, you can change your posture before we step into our next practice. Keeping the back and neck straight, we will begin with yogic deep breathing. Exhale completely. As you begin to inhale, feel your abdomen rise. Expand the chest and fill in the air properly so that you feel a rise in your collarbones. As you exhale, go in the reverse order. Relax the collarbones. Relax the chest. And squeeze your abdomen. Continue your practice. Keep the mind engaged as the various portions of your torso move out and in. Complete your next round and then suspend your practice. Simply observe the natural flow of the breath. Before we begin our next practice, you can change your posture slightly if you feel the need. Adjust your body. We'll go for a few rounds of Anulom-Vilom next. With the right hand, form the Pranav or the Nasagra Mudra. Exhale fully. Close the right nostril. Begin to inhale through the left nostril. Once you complete your inhalation, close the left nostril, open the right nostril, and exhale. After your exhalation, begin to inhale through the right side. Close the right nostril, open the left nostril, and exhale. This is one round. Continue your practice. Keep the inhalations and exhalations equal. Find your own pace as you deepen the practice of Anulom Vilom. Complete 3 more rounds and then relax your hand. Keep your back and neck straight and simply observe the impact of the practice, a sense of balance and peace induced because of the practice of Anulom Vilom. You can choose to change your posture before we step into our final practice, the practice of Bhastrika Pranayama. Bring your back and neck straight. Begin the practice after your next exhalation. So the inhalation and exhalation both should be active. Body should be relaxed. Try to keep your face relaxed. Expand your and contract your chest properly. Go at the most suitable pace for you. Keep the inhalation and exhalation equal. After your next round, after the exhalation, form the Pranav Mudra or the Nasagri Mudra with the right hand and go for one round of Surya Pranayama, closing the left nostril and inhaling to the right side. And then after your inhalation, exhale through the left side. Keeping the back and neck straight. Observe the impact of your practice. We will end today's session with one Om chanting, followed by 3 Shanties. Keep your back and neck straight. Take a deep breath in for Om. Shanti, Shanti, Shanti. Join your palms together and gently bow down. Sense of gratitude and respect. Begin to rub your palms together. Keep the palms on the eyes. We'll do this one more time. Rub the palms together. Keep them on the eyes. Very slowly, while blinking and looking at the palms, you can open up your eyes, come back with a big smile. Namaste, everyone. Any issues that you faced? Any problem?
No, ma'am.
Okay. You're going at a slower pace, I think.
Yes.
So you were able to keep the inhalations and exhalations equal?
Yes, ma'am.
Yeah.
Ma'am, it's
Okay.
okay to count in mind because that's the only way I can keep the inhibition. Because with me, even in Anulom Vilom, what was happening when I was exhaling from my right nostril, the exhalation was okay. But I mean, as in if it's 10 counts inhalation, then 10 counts exhalation. But from my left nostril, the exhalation was, I think, only 4, 5 counts. The exhalation was lesser from my left nostril and more from my right nostril. And when I'm using both the nostrils, that time I don't realize. But
Hmm.
one at a time, at least I come to know that, this one, it was like just done. So I was putting in little effort that at least, whatever air is there, it can come out from the left nostril.
Okay, so for this thing, a lot of us we go into mental counting, and
Hmm.
this count, makes us lose touch with our actual breath. So suppose you are
Yeah.
counting till 5 or 10. Okay,
Hmm.
so maybe in your exhalation right now you don't have the capacity to go till 10. So of course you will begin to regulate it a little bit, but then
Yeah.
also the counting also gets manipulated a lot of time. So suppose you have less air, right? Then you will manipulate the counting a little bit. You will feel as if you are counting at the same pace, but you are going a little bit faster. So count isn't the right metric to judge, because again your mind will play games with you, right? So and it will make you lose touch with your reality. So suppose you can only exhale for 5 seconds, right? But now somebody is counting. So right now you are doing internal counting, but suppose I was counting, right, for you guys when you did this thing. So then you will start doing what? You will exhale till 3. Suppose I'm counting till 5, you will exhale till 3 and you will hold for 2 seconds. Okay, you will wait for my count to get completed, because I will be counting objectively. But in your mind, of course, the mind can change the
Hmm.
pace. But if I'm
Right.
counting, some external counting is going on, then you will like exhale in 3 and then hold for 2. Right? Again, you are not developing the natural pace of the breath. You are working on the other thing, right, which is not your target. That is why the pre practices are so important. So right
Yes.
now, see, you will get a rough idea of if it's equal or, and that
Hmm.
is exactly what you have to develop. You have to sharpen the mind also, because the other practices which are after this, they are already trying to sharpen your mind, right? So it's very
Okay.
important that the mind is aware. So this will also keep the mind aware throughout the practice. So right now, if you are doing mental counting, suppose you are doing the practice, it becomes so relaxative. So for some
Hmm.
people, if we do the counting, they become so relaxed that they sleep, right? So counting, that is why counting has a lot of drawbacks. Even though
Okay.
mentally we start doing it, it becomes it comes very automatically to us that
Automatically.
if,
Yeah.
yes, but you have to try to avoid this, because the counting or the word, so sometimes word is also used, they will make you lose touch with your reality. And if
Okay.
you keep your mind properly focused on your practice, then you will gain an idea of the equality of the breath, or if it's equal or not, or at least you will begin to get a rough idea. So you will move more towards the advanced practices with this
Okay.
approach, because in meditation, in concentration, you are trying to actually sharpen the mind only, right? So you can, this is how you also incorporate all of this with the pranayama, right? So try to suspend the counting and just
Okay.
simply, you have to trust yourself over here. You have to trust yourself that you will gain the knowledge. But the more you practice, the better you get at it, like any other thing, right?
Okay, ma'am.
So in upcoming classes, try to completely be
Yes.
free from the counting, right?
Okay,
Or
ma'am.
minimize it
Okay,
uh,
ma'am.
as much as you can. Yeah. All right.
Okay.
Okay. Any
Thank
other
you, ma'am.
doubts?
No.
All right. Okay. So I'll see you tomorrow. Take care. Bye bye.
You too, ma'am. Bye bye.